So good morning, everybody. We appreciate you all being here. Happy Friday. It's been a short week, but it's been a busy one for us. I'm sure it has for you all as well. So Andrea, I'm going to talk for just a second, but I'm going to put you on the spot. So we typically start this meeting with United Way of Bristol, just sharing updates, information, any kind of new resources or any questions that anybody has. So Andrea, I am going to throw it over to you to see what United Way of Bristol has going on.
Well, thank you, Melissa. We are still busy working on COVID CARES utility assistance for those residents who live in the city of Bristol, Tennessee, and the residents who live in the city of Bristol, Virginia, and have been financially impacted by COVID, which everybody has been financially impacted. But if they have lost their job or lost job hours, because of COVID, directly related to COVID, then if you would refer them to our office, and we will see if they qualify and help them with utility assistance. And that's what's been keeping me busy.
That's for Bristol.
I'm sorry.
Is that just Bristol, Tennessee, or is it for both?
Residents of Bristol, Tennessee and Bristol, Virginia.
Okay. My internet connection is unstable. Just telling you, Karen.
Okay.
All right, great. So let's see. Karen, do you want to give some updates on Family Promise and what you all are doing with that?
Sure. So what Family Promise of Bristol is currently working on is opening a place to be day center at Salvation Army. We're planning to open around mid-July with those services. And those will be Tuesday through Thursday from 9 a.m. until 3 p.m. We do still have some homeless prevention dollars, so we are still helping Sullivan County residents with homeless prevention services at this time. And those are the main things that we have going on. We are going to be sending out a partnership survey for day center services just to get some feedback from you guys. I think they're going to send it out in this email when they send that out. And then we are also surveying some members of the homeless community in the area at Proverbs 3:27. And then when they're calling us for intakes, we're also surveying just to see what type of services people are looking to have provided at the day center when we open mid-July. But those are our big updates.
Great. And so at the day center, is it still intended to be low barrier?
It is going to be low barrier.
Okay. And have you all figured out if you're going to, if a family shows up, children?
Families are welcome.
Okay. All right.
Yep.
Fantastic. Thank you. Okay. Anything else about housing supports before we move into healthcare? Okay. So I see Cindy Rocket. I don't know if you're able to share with us what you got going on over there.
Hi there. First of all, how exciting that the day center is happening. Yay. Thanks for that, Karen. So I'm Cindy Rocket, Crossroads Medical Mission, and Crossroads is now both a mobile medical clinic and a downtown clinic on Scott Street, Bristol, Virginia. And so also on this call is Caroline Hawkins, who is one of our newest staff members and a community health worker. But Crossroads is now kind of offering clinics Tuesdays and Thursdays at 433 Scott Street, in addition to our mobile clinic. So we make appointments, that's our preference. Our day clinics, walk-ins are welcome between 9 and 11 a.m. But anybody can call, set up an appointment, 276-466-1600. And we are targeting folks who are uninsured. There you have it.
Wonderful, Cindy. Thank you. And welcome, Caroline. All right, Bree, over there at Healing Hands, what do you all have going on?
Okay, so I am like joining you all from outside one of my clients' houses. We're fixing to baptize her mother that is not doing very well. So I'm just stepping away for 2 seconds. But we have a new dentist coming on board in August. We have a new primary care physician coming on in August. So we are now accepting patients in medical right now. And we will be opening back up our dental wait list as soon as we get, I think they said they'll open it up at the end of July. So then we'll be able to start having more dental patients because we've been on hold for quite some time. And then, of course, I'm still accepting referrals, mostly Virginia patients. But if you have an emergency, please call. Don't care to work with whoever. I'm just out here to help whoever needs it.
Great. Thank you, Bree. And thank you for joining us from on site. We know what that's like. Brandy does that often. So anything else medical? Any questions? Any other updates? I know dental is a real big need in our area right now. Like Bree said, they've been on hold with their dental for a while, but that's one of the biggest needs that we see in our area. Okay. See, so Courtney.
Did you call on me? Y'all must be breaking up or I'm breaking up.
Yes, Courtney, I think she did go ahead and call on you. I think Melissa's internet's a little wonky today. So if
Okay,
you can go ahead and give us your update, that'd be great.
okay. I'm Courtney. I'm with Healthy Families of Sullivan County. We're an evidence-based home visiting program. We're just continuing to see prenatal moms and infants up to 3 months of age. Go over the ASQs with them, ACEs, prenatal and postnatal depression screens is what we focus on, and anything else that they may need community resource wise. So that's what we're out doing.
Great, Courtney. Thank you. I turned my video off hoping that that will help. So we'll see. Fingers crossed. All right, April, do you have some updates?
Yes, I am a community health worker for the Virginia Department of Health. And right now, me and the other community health workers are working on setting up resource tables at organizations and events with like all of the information on the services we provide. We are trying to connect with individuals in our community to provide them with any resources they may need. If you would be interested in us coming to your organization, I will put my email in the chat and you can reach out to me. We are also still offering Revive training. So if y'all would be interested in that, you can email me. We are also doing the Giving Project. You can take any, you can donate anything and take it to the local health departments. And I did get a question last time asking if there was a deadline or if it's ongoing. It is ongoing. There is no deadline for that. And then we also have a community health assessment survey, and I will put the link in the chat for anybody that would like to fill out the survey. It's you can talk about the concerns that you have in the community. And I think that's it.
April, can I ask a quick question? The survey, yes. The results that you're getting from the survey, how is that going to be used moving forward? Like, where does that go, that information?
We have meetings. Well, our next meeting is in August, and we'll go over everything and see what we can do and try to help out the community.
Okay, so it's an internal thing then.
Yeah.
Okay.
Yeah, and we were at that first meeting. It was really great. Brian Forbes Hubbard kind of in April. I don't know if you were there or not.
Yes, okay. I was.
So I probably did meet you, but basically the CHA, they're required to do, we started it pre-COVID, got together, figured out what was going to happen for the next little while, and then COVID hit. So it's kind of starting from scratch again. And we've had our first meeting, and the next one, like April said, is in August, but there is a survey. So April, if you'll share that, we'll get that out to everybody.
Okay, thank you.
Thank you. Miss Linda, I noticed you put a ton of stuff in the chat that you've got going on, but do you want to share some of those things?
Sure. I put the link in there for an informational video and also registration for Open Table. It is a new ministry that ASAC will be starting with Anthem. And a table is 6 people who wrap around a either pregnant or parenting young lady. So it is a 12-month program where people commit to a relationship with this young lady and her children if she already is mothering and the newborn that's coming along. So there is a noon informational meeting coming up on the 29th, and then a 7 p.m. informational meeting on July 7. There is a little video. There's a young lady who was pregnant when she aged out of foster that did a video with them. So that'll give you more information about what we hope will happen here in the Tri-Cities. It is happening across the Commonwealth. There are 7 tables already, and we hope to have 3. At least 3 in the region.
Linda, where's that going to be held?
It's
Where I'm sorry. Oh, okay. Well, that's easy.
Yeah. It's happening wherever you are, Eric. Thank you to those of you who came and participated in the resource fair. We had 45 vendors that came to the resource and networking fair, and it was a wonderful day. And so we're very grateful for your participation in that. August the 6th, we have Dr. Monty Burks, a national speaker, coming to Saltville. Saltville asked for a recovery rally, and we were able to get on Monty's schedule. So I know I see some confused looks there, Brandy. The metropolis of Saltville.
I know where the library is in Saltville. Like, I was just amazed that there's a library. So this is fantastic news.
Yes. There is a strong faith-based community over there. So they have asked ASAC's Faith Community Initiative to bring a recovery rally over there. And so we'll do that on August the 6th. And Monty is available that day. So it just worked out. So his life will never be the same. Once he leaves Nashville and comes to Saltville, I'm sure he'll be relocating. But they had a back to school bash already planned that day. So it's going to fit in perfectly. Lots of fun and music and food, and Monty will be speaking. So put that on your schedule. I'm not sure of the times yet, but we'll be in Saltville, downtown Saltville that day, August the 6th. So thank you.
Wonderful, Linda. Thank you so much.
And just a reminder, if you have not gotten your second booster, get it. I have been putting that off because my schedule is a little hectic, but I've had COVID this week again. So just a reminder, a PSA, if you haven't gotten your booster, get it.
Thank you. I'm so sorry about that. I hope that you are low symptom.
It's been the worst of the 3 bouts I've had.
Wow.
2 vaccines and a booster and a flu shot. And this has been the worst. So take care.
If you need anything, we are old pros at soup drops. Drop the soup on your porch and run.
I appreciate that.
Well, thank you, Linda. We hope you get to feeling better soon. Eric, what you got going on?
Nothing really out of the ordinary. I'm just mostly tuning in to hear what else is going on in the region, across the city, and what you all are dealing with, and if there's ways that we can either connect you to resources or support you. But for me specifically, there's nothing unique to bring up.
Okay, well, we appreciate you being here. We always
Yeah.
enjoy seeing you. All right, Miss Brandy, what are you what do you have going on?
So good morning, everybody. It's good to see everybody's face. So yesterday we hosted our trauma-informed care network for the upper 8 counties of East Tennessee, and it went really well. We had Melissa and Tina McDaniel were guest speakers. So Melissa spoke about ACEs and new emerging studies and how some environmental impacts are also being considered with the new ACEs study. So that was very informational. And then Tina touched on the significance of Juneteenth, and while we know Juneteenth is a celebration, it is also a time of healing with our communities and how that has kind of evolved over the years. So our next trauma-informed care meeting for the Tennessee side is August 25th. It'll be on our community calendar. So please join us. I am supposed to have great speakers and topics for that next meeting. I'll let you know how that goes. I haven't started on it yet, but we'll see what we can get some information just to try to keep our community moving forward as far as the trauma-informed care community. The Bristol Connect program is still up and going strong. We are still partnered with 3 businesses, 2 manufacturers and a nonprofit in our area. We are moving forward with a nonprofit with their workforce group that they are doing, and they are doing some very specific trainings to try to make them better employees and more employable throughout our community. And we know that people are struggling to find employees. They're struggling to keep employees. And so if we can create those types of pipelines, I think that'll be very helpful. The 2 manufacturers that I'm working with, they are still struggling to find employees. So if you, in fact, one of them needs like 70 people. So if you know of anybody that is looking for a job, they have some sign-on bonuses going on right now. They've, I don't want to use the word lowered, but they have lowered some of their requirements to be employed at these 2 manufacturers. So send them my way, or send them directly over to Strongwell and Robinette, the bag company. They are both hiring. I don't know if Erica was introduced. She's to my right on my screen, but I'm not sure. Can you wave, Erica? Okay, Erica is our newest employee. She started Tuesday, and it was trial by fire. I stuck her in the car with me on Thursday, and we hit businesses wide open. So we are hoping to be able to take this time and kind of expand with more businesses, because we believe that workforce sustainability program is just so important at this point in time, getting people employed so they can take care of their families, so they can be prosperous community members. I really believe that's really important. So if you know of any businesses that really want to treat their employees good and believe in family-friendly policies, man, send them my way, because I really would like to work with a few more businesses like that. So that's on my future, right? I'm working towards that. That's a goal of mine. So
Brandy, can you share who the 2 manufacturers that you're working with that are actively needing employees are, or do we just need to if we bump into people, or churches are out there bumping into people that need work, do we just need to tell them to contact you for more information?
Oh, they can contact them directly. I'll put them in the chat, and I'll give you some contact numbers too.
Okay.
All right. Any questions for me?
Thank you, Brandy.
Great.
And I will say there is an article that came out, well, not an article, but it was on WCYB this morning, about 47% of the Bristol workforce are currently not working. But I do want you all to understand that those are just really big numbers, and there's probably more to it, because it doesn't say how many are retired. It doesn't say how many are disabled. It doesn't really kind of show that full picture. So Brandy, you private messaged that to me, by the way. She meant to post it in the chat, but
already know that. I'll fix it.
Just know that those numbers might be a little inflammatory for folks. And so if somebody comes and talks to you about it, just know that those numbers are just part of the story. So, I was kind of disappointed that there wasn't a deeper dive into that. We do know that that there are a lot of people who are unemployed for one reason or another. So, Erica, do you want to say hi since you've been introduced now?
Hello.
So yeah, Erica started with us on Tuesday. We're excited to have her. A couple of other things just for you all to know. In our trauma responsive care meeting yesterday, Tennessee Voices is happy to offer QPR, which is question, persuade, refer training. It is a suicide intervention training and it is fantastic. I really would love to see everybody get QPR training. It really is learning how to ask the question and being more comfortable, not that you're ever comfortable, but learning how to ask the question, persuading them not to kill themselves, and then referring them to appropriate services. So if anybody is interested in that, you can reach out to me or Brandy or Erica, and we'll get you connected with that. Also, we know that Bristol, Virginia Public Schools had a great fentanyl awareness day right before the end of school, had lots of vendors, all of their kids were there. It was really, really great to be able to connect with them and talk with them. Bristol, Tennessee City Schools is planning something very similar to that at the beginning of the school year. So if anybody is interested in being on that planning team, again, please let me know. They're in the early stages of planning for that. And we want to be sure that our kids on both sides of the state line get access to information on Narcan and information on fentanyl and other drugs to make, safe choices. All right. Is there anybody that I forgot? Any other updates, information? Y'all, this is going to be the shortest meeting in history. All right, friends. Well, I greatly appreciate all of you being here. Just a couple of dates for you all so that you do know. The next Bristol Coalition. So as you all know, at the beginning of COVID, Family Promise started these meetings on a weekly basis to kind of keep us together on food insecurities and housing issues and health issues. And as COVID has kind of gotten a handle a little bit, although our numbers are iffy, but as we've gotten a handle on it, we've gone to monthly meetings in collaboration with the Bristol Coalition meetings. So Bristol Coalition meets on one end of the month and we meet on the other. The next Bristol Coalition meeting is scheduled for Tuesday, July 12th from noon until 1:30. They've been starting this month. They started hosting them in person again at the Bristol, Virginia Housing Authority. So they do provide lunch. They have a little bit of informational session in the beginning and then share updates and information. And so with that, our next meeting is scheduled for Friday, July 22nd at 11 a.m. So anything else? No? 11:24, you all get over 30 minutes of your day back. I hope you have a beautiful Friday, a beautiful weekend. And if we don't see you before, happy 4th of July, and we'll see you next month. Thank you all so much.
Thanks, Melissa.
All right, bye.
Yeah, bye.
Bye, guys.